Hello, I'm Tim Carpenter, Vice President of EHR Consulting. I'd like to take just a couple of minutes to talk to you about addressing challenges with your EHR in a strategic and thoughtful way. Many organizations reach out to us to assist them with problems they're having with their current EHR or to guide them in the selection of a new system. In many cases, their EHR isn't supporting newer workflows and requirements, often resulting in documentation being done outside of the system. They may have significant revenue cycle challenges, and they may have gaps in compliance and key metric tracking and reporting. And some of these may sound familiar to you. So we suggest you really approach your next steps in a strategic way. There can be a tendency to think that replacing the EHR, and especially if you've been on the same system for a number of years, is the natural next step. And although replacing the EHR may ultimately be the right step, it's important to evaluate your options carefully to ensure that the financial investment and effort to implement the new EHR is the right choice, is really going to lead you to the right place. So we suggest you carefully assess and evaluate your current EHR challenges and pain points, and evaluate the opportunities to optimize the current system to address these issues. And we suggest you do it in an inventory kind of way. Really create a raw inventory of each of the problems and challenges, and then work with an internal system expert or external system expert to identify and document steps, workflow steps, or functionality that can be used to resolve or address the issue. In some cases, these are workflows outside of the system. In other cases, it's system functionality, and oftentimes it's both. Taking this systematic approach to the assessment and solutioning will provide your organization clarity as to whether the EHR can be effectively optimized to meet your needs, or whether a new system selection is warranted. Can you get the system close enough that it dramatically improves the outcomes you're trying to achieve? The inventory that I talked about that you create as part of this process becomes a useful tool regardless of your final decision. It can serve as a prioritized plan for executing the optimization of your EHR. Or alternatively, if the gaps are too great and they can't be met, can't be resolved, you now have a strong set of key requirements that can be used to really be a springboard toward the selection of a new system, a new EHR. Our consultants have led many organizations through EHR optimizations and selection processes. So please contact us if we can answer any questions or be of assistance. Thanks for your time.